Dr. Almateen says the spike in children and teens being treated for depression and anxiety may also be linked to fears about violence like school shootings, increased academic and athletic stresses, and the fact that more parents are acknowledging behavior changes and concerns with their kids. As parents become more aware of the warning signs of mental health challenges, often the question is, what's next? Often families don't know where to turn, get frustrated with the dead-end internet searches, and fear they're the only ones going through it. That's why VTCC has family navigators, friendly faces who are there for the families to help guide and support them in what can be an overwhelming process. We have one of those with us now, Robin Church. Welcome. Thank you for coming in today.
Thank you.
What is the role of the family navigator at VTCC?
So what a family navigator does is connect with the family to get them services in the community statewide for whatever it is that they feel that their child needs or their family as a whole. We have support groups for families. We connect with the families and let them know that they are not going through this alone, that they have somebody with them. We walk with them through this process that they're going through. And not only do we just give resources to the families, we follow up with the families to let them know that we're here and to check in and see if we're happy with the providers that we're given.
And what are some of the common concerns you see when these families are coming in?
They're lost, they're confused, they're overwhelmed, they are blaming themselves for what their child may be going through, and they don't know where to turn. No one's listening to them, no one understands what they're going through.
How do you handle that stress, that diagnosis? Those early days have to be so grueling for
Absolutely,
families.
absolutely. So the stressors are, the parents may feel like they're burdened by their child. I personally can remember feeling like I didn't want to wake up the next morning because of the way my child was. I didn't know what to do for him. I didn't know where to turn.
And you touch upon it there. What is your personal story? I know it's a very compelling one. Your son has been diagnosed with several conditions.
He has. He's been diagnosed with autism spectrum disorder, sensory processing disorder, ADHD, depression, anxiety. He has struggled since he was very young. It started in the hospital when he had some medical issues, and then when he started early intervention at age 3 or at age 2, we were noticing some things that were going on, and then as he was learning to crawl and walk, he was hurting other children. And I often looked at him and said, what child at this age wants to hurt other children? But he would crawl to other children at the daycare that he was attending and choke them. And I often wondered, where is this coming from? And as he began to get a little bit older, he was very violent towards myself and his brother. And I didn't know what was happening. I didn't know where he was getting this from and what was creating this problem. He was hospitalized twice, once at 6 and once at 7. And we also had been through 3 public schools and one private school and 8 months of homebound before the end of 2nd grade, which is where he started attending the Faison School for Autism.
So you mentioned your family's going through this. There was that other sibling there.
Yes.
It is a whole family issue. How do you make sure that another child who's growing up with a sibling with a mental health challenge is getting the attention they need?
Right, yeah, you know, that was the hardest piece, to be honest with you, because my oldest son, who is 2 years older, came to me several times and said, Mom, there's so many people in the house. We had in-home workers, we had OT in the home, we had mentors in the home. But all these people kept coming into our home, and my oldest son looked at me and he said, Mom, he's doing so much to hurt us. So why do these people come to see him? And how come I get nobody? And when he said those words, I get emotional when I think about it, but when he said those words to me, that's when it resonated with me that, oh my gosh, it's all of us. It's not just my son who's constantly in crisis, and it's not me always feeling like I'm in crisis with him, but there's my oldest son, and he is begging me for help right now. He's noticing that he's being left out. So it's very important that we recognize that the whole family is going through this crisis, and you get the siblings need something that's just for them as well. I did enroll him into Taekwondo because he was having a lot of anger issues because of what his brother was putting us through. And so Taekwondo kind of helped him learn about his body and how he was feeling and get some of those frustrations out.
Robin Church, your experience is such a valuable part of the
Yep.
really the healing process for entire families as they go through this diagnosis and treatment. Thank you for coming in and sharing your insight today. And for more information on the Virginia Treatment Center for Children, which is part of the Children's Hospital of Richmond at VCU, go to chrichmond.org/VTCC. We also do want to mention VTCC has telemedicine programs too.